I think we're recording now. Thank you for the reminder, Melina. Okay, so Impact West Virginia was looking to do some grants, and we were doing some research on some articles. And we found one that talks about substance use disorder putting people at a greater risk for COVID-19 complications. And we started talking about a recent study examining vaccine readiness among people with substance use disorder. And this showed that nearly half of the participants reported they were unwilling to take the vaccine. And as we started making connections for this presentation today, and I spoke with Kayla before we started, she was actually one of the people that conducted these interviews. So I've asked her kind of short notice, but if she would give us a little more information about this study before we go on. So Kayla, I'll turn it over to you.
Thank you so much. And like Charlotte said, my name's Kayla. And so we did this study a little bit earlier, I think in the last year. And on this study, we asked about like 87 different people, and we did one-on-one interviews, and they took about like 20 to 45 minutes. And so we asked them a variety of different questions, and we were trying to get at, were people willing to get the vaccine? And if not, kind of what was their hesitancy? A lot of people were explaining, you know, whether it was the route of administration because they were like IV drug users before, that they weren't as comfortable getting like a shot. It was something that was kind of triggering to them. Some people were sharing that they didn't feel like it was tested enough. Other people, you know, another kind of like thing that we got from the study was the people that were conveying the message. You know, who do people listen to with medical advice about COVID-19, about the vaccine? And a lot of people said that they listened to their personal doctors. And so this like really helped us dive into, okay, if we're trying to encourage more people to get the vaccine, what type of people do we need to utilize? What kind of messenger do we need to utilize to help encourage people to get this vaccine? So it really gave us a lot of insight into like what's kind of holding people back. What are things we could do to kind of educate people to hopefully help them make that decision that is best for their health. And so it was really interesting to kind of get everyone's different perspectives.
Thank you. That's really interesting. And we found the article very interesting. So if those of you who are joining us, and I'm happy to share the slides after our presentation today, but we do have the link to the article there. So if you want to read some more about it, feel free to do so. So with that opening, we want to go into what are we going to be talking about today in order to increase vaccine confidence in the substance use population. And we're really going to talk about basing this on the stages of change. So Impact West Virginia's team will discuss the hashtag Impact COVID campaign that we've been working on. And then Kayla's going to be talking about the addictionpolicy.org Vaccine Navigator Initiative. So I wanted to start with a polling question. So if you would, in the chat, please answer the following. How might we make vaccine confidence more visible to families? So what do you think we can do to make this vaccine confidence visible for families to be able to see? We're going to talk about the results of that in just a little bit, but I'm going to go ahead, give you some time to answer, and we're going to go on to the next slide for a little bit of background. So Impact is working with communities to create opportunities addressing needs of children diagnosed with NAS or neonatal abstinence syndrome, or who were exposed to substances in utero. And this program is a two-generational way of thinking. So not only do we look at the infant, but we also want to look at the mom or the grandma, any type of kinship care. Maybe there's foster care or adoptive care in place. So we want to look at what affects the mom and or the parent in that situation, and also the infant. So we're working to coordinate programs and services addressing barriers to the care that might impact the children's health and future development. And right now, looking at the whole family is highlighting the importance of the family in shaping the children's health and future. So now that we have COVID-19, this decision to impact the health of the families in West Virginia is even more important at this time. So Impact worked and got an agreement with the Centers for Disease Control and Prevention, the Association of University Centers on Disabilities, and we have a COVID-19 Vaccine Confidence Grant. Now this one that we're working on is very short term. It's only been a couple of months, but the CED will also have another grant that will be running longer, about a year. So we want to increase vaccine confidence, and we're targeting, like I said previously, those with a substance use disorder, and we're doing messaging based on the stages of change. So let's look at our polling question results when we talked about making vaccine confidence visible to families. And Melina, are you able to share, did anybody give us their ideas on that?
Yes, we did have one in the chat say having personal testimony from those who are having success in place where the families are present most would be a good idea. Someone else said reach out and attend NA and AA meetings. So if anyone else has other suggestions, you can put them in the chat or unmute to share now.
And even Kayla, if you have ideas from your group talking about making the vaccine confidence visible to families that you want to share, we're happy to hear that.
Yeah, I think, you know, individuals sharing their personal experience with it, and even like their hesitation, like what was your hesitation and what kind of changed your decision to decide to get the vaccine. I think that's something that can help people because they might have the same hesitations in the first place. And then also being very cognizant of like who you're utilizing to share the message, like the messengers.
Like how you noted in your study that a lot of them were getting information from the provider. So making sure the providers have that good pathway and the right wording and the right way to help with maybe misconceptions or barriers. Thank you. Okay, so we're going to have a second polling question. We're not going to have a lot of these, but the next one is, what are the barriers to vaccine accessibility? So now we were wanting to make it confidence, you know, visible to them, but now what are the barriers that they might not receive it? So while you think about that and answer in the chat, we're going to go on. So I mentioned earlier the stages of change assessment questions. So we've kind of based our initiative here on 4 types of stages. There is a 5th one in the stages of change, which is maintenance, the last phase, which we've incorporated a little bit, but I wanted to concentrate on these 4 today. So pre-contemplation. This is a person that may not be considering the vaccine at all. Contemplation. They have knowledge of the vaccine, but they have not yet been vaccinated, usually due to some type of barrier. Preparation. This is a person who intends on taking the vaccine, but they just haven't gotten around to it yet. And then the 4th phase, we talk about action, which they want to actually take the vaccine. So now that we've, you know, talked to this person or participant or client, and we kind of know what level they may be on, what do? Well, we have provided appropriate materials based on that stage, and I'll give you a little more detail about that in a minute. And we help navigate the client to the proper resources. And this slide just has a readiness ruler is what they call it. And so you kind of can ask the participant, where are you on these stages of change? And this can be with anything, not just the vaccine. So, a 0 to a 3, they're really not ready to change. 4 to a 6, they're not quite sure. And then a 7 to a 10, they're ready to change. And sometimes it's good, you can use this kind of a pre and post kind of thing. So they might be at a 1, and then you share resources, and then they might have moved to a 6 or a 7. So this is just kind of a little visual for you to see. So Impact West Virginia has been working pretty hard, and here are the type of products that we've developed with this grant. So we've had billboards, we've launched a Facebook ad campaign, we've developed posters, flyers, postcards, we've added a website edition with vaccine information and resources to our Impact West Virginia site. And Melina's also helped us develop a downloadable social media toolkit. So we'll look at these a little bit as we go on. So this slide shows what our billboards look like, and they were located in Mon, Marion, Preston, and Harrison counties. And again, Melina and our graphics department help us put these together. And remember, we're looking at the substance use population with this information. But we also wanted to make sure, as you can see with the one for recovery, stating that the road to recovery is long, but we don't want COVID-19 to stop you. And we put information about where to find free vaccines or vaccine information with these billboards. We've also developed a Facebook ad campaign, and I have the link here if you want to go to our Facebook page. This is an example of one of the posts that Melina helped us put up, and it actually has a real picture of one of our billboards that you can see here. We looked at how can we target, or who should we target with this Facebook ad campaign? So we looked at the top 10 counties with the highest overdose rates in West Virginia. We looked at vaccination rates in the counties in West Virginia. We looked at the counties with under 50% vaccination rate. And then we also looked at information from the Rural Health Hub, talking about substance use in rural areas where they stated low education attainment, poverty, unemployment, isolation, lack of health care access is some of the reasons for substance use in rural areas. And so we added into our Facebook ad campaign some percentages of people in poverty so that this campaign would target certain areas of West Virginia. And our main counties that came from this way that we narrowed it down was Cabell, Berkeley, Raleigh, Mercer, Logan, Harrison, and Marion. So that's where our ad campaign is currently running. So we're going to go back to our second polling question about vaccine accessibility barriers. Melina, anybody share in the chat what they think might have been a barrier to the vaccine?
Yes, we had some good conversations. Someone agreed that experience sharing is always great. They also think that helping people get appointments and transportation to get the vaccine would be helpful. Someone else agreed that transportation is always a barrier. Again, transportation and internet access within rural areas are barriers. Someone shared that feeling safe is often an issue and trust is a barrier, and misinformation is an issue.
Thank you all for sharing that. And those are things, as we've been talking about, how can we, improve this vaccine confidence? Those are all things that we've ran across in our conversations also. So what did we do based on that in our stages of change messaging? So we kind of took a question first, and then we added either a fact, a resource type of fact from a resource, or an encouraging statement that we could share, and then a list of links and resources to provide to the clients or the participants. So for pre-contemplation, and remember, this is someone that's not really considering the vaccine. So this is what one of our posters looked like. And we said, again, we pointed out the study. Did you know about this study? And that it increased your risk for the COVID risks. And then we talked about learning more about COVID-19 and the severity of increased substance use during the pandemic, safer drug use, harm reduction strategies, access to treatment, and also access to the vaccine. So we know we have this person who's not really considering it, but we just want to let them know. You might be at increased risk. Here are some things for you to think about. Here are some resources that you can go to. So these links were from the CDC, the first one, and it was talking about extra precautions that you might need to be following when you have a substance use disorder and you're at risk for COVID. So it talked about things about not only washing your hands, but also, for example, if you are an IV drug user, making sure that you're keeping that injection site even cleaner, because you don't want to worry about infection and things at that site either. We also have a link here from the CDC for the disability population that has some easy to read formatted resources there. So next, after pre-contemplation, we have contemplation. And remember, this is someone that knows about the vaccine, but they haven't gotten it because they're worried about barriers. And one of the barriers, as you can see on our poster, this lady says, no, it hasn't really been around long enough. I'm not sure if it's safe. And so we put a little, that's our kind of question. And then we put some statements here. Over 300 million people have been vaccinated. No safety issues reported linking substance use to adverse reactions in the vaccines. And so then we have, again, some links here to the CDC vaccine frequently asked questions, vaccination recommendations for someone who might be pregnant, and then additional AUCD resources and drugabuse.gov COVID-19 resources. So our next space we go into is someone that is preparing to take the vaccine. So they're intending to, but they're not quite sure, how do I go about that? So again, our question that states that preparation phase, and then we kind of give that encouragement statement. Make the decision to impact your health and the future of yourself and your family. And then here we encourage them to learn more about the benefits of getting the COVID-19 vaccine. And on this particular poster, we wanted to add in some information here about the West Virginia initiative. So we kind of said, now's the time to do it. And we talked about the vaccine lotteries and the $100 gift cards that those at a certain age may be able to get. Again, our links to resources, cdc.gov, vaccine benefits. And then we also included here the Vaccine Navigator Initiative. And that's where Kayla joins us today. And this is the link to her site and talking about the Vaccine Navigator Initiative. So I'm going to go to the next slide and turn it over to Kayla for a few minutes.
Thank you so much. So our Vaccine Navigator Initiative, we got funding from the FOR Foundation. So it's the Foundation of Opiate Response Efforts. And so for this, we really realize that individuals, there's so much information out there. And so it's very difficult to navigate what kind of information. When we originally launched this, not everyone was eligible to receive the vaccine. So, navigating, am I eligible? Am I not eligible? So what individuals can do is they can go to our website and fill out this questionnaire. They can also call our helpline, or they can text into our helpline, and they can receive support around, any questions they have, getting that appointment. We can't schedule appointments for individuals, but we give them information about, okay, these are locations that you can go for appointments. This is the timing, this is the vaccine that they're offering there. Some sites, because this is a nationwide initiative, so we have people all over the US reaching out to us. Some states have transportation, which is a huge barrier to people. So, you know, we can give them information about transportation. You know, we always try to provide that educational information, just like you guys are doing, because there's a lot of questions, you know, so we like to give frequent asked questions. We're also putting out, coming up soon, we'll have a new updated frequently asked questions from individuals who have reached out to us to kind of answer some more of those questions. And so we'll be releasing that as well. And so this really gives them an opportunity not only to get help with finding a vaccine appointment, being educated, but also this gives them an opportunity if they need extra support around their recovery. Because as many know, during COVID, it was very isolating, and addiction is a very isolating disease to have. And so giving them the opportunity to also have that helping hand if they need extra supports or they need help getting into treatment, we like to offer those supports as well.
Just wanted to add that I kind of went through the steps of this to see what it was like. And on the right of this slide shows you what questions are asked on the Vaccine Navigator request form. So it's nothing it doesn't take too long. It's nothing in too much detail, but I just wanted to give you let you see what it was like. And then Kayla, did you want to tell, I added this slide because this is kind of what happened in the follow-up for me. So Kayla, I'll let you maybe talk about this one a little bit more.
Yeah, definitely. So when someone reaches out to us, then someone like myself, I'm a lead engagement specialist there, we'll reach back out through email, and we provide information about, okay, are you eligible in your area? We also ask about pre-existing conditions. So if before, pre-existing conditions were really important because this made someone more eligible quicker. We also talk about the different locations. So we try to give as many locations as possible that someone can go to, because we know that, you know, whether someone's working or there's different times that they can go. We also like to give people walk-in places so they can just walk in when they can get in there. And then we provide frequent asked questions from the CDC as well as from their own state to give them some more information. And then just like I was saying, you know, we try to give them information about the treatment and recovery resources in their area. And so I sent a couple different questions to kind of gain more information about, okay, where's this person at? Are they currently in recovery and just having a hard time and need extra support? Are they still actively using substances, and do they need like a detox program or something like that, like gauging where they're at in their recovery journey. And then just to throw on top of that, you know, we also have we've been doing webinars as part of this, and we did a webinar with Dr. Fauci and Nora Volkoff, who's really big in the addiction space. She's an addiction psychiatrist, and so trying to educate people not only about this initiative, but also about, like Charlotte was saying, about how individuals who have a substance use disorder, whether it's an active substance use disorder or, you know, they're currently in recovery, they're at higher risk. And so trying to educate people about that. And we have one coming up this Thursday with the CDC to kind of go into the Vaccine Navigator project, as well as other topics around the COVID-19 vaccine.
Thank you, Kayla. And is that a webinar that you could share with us that I could send to the group, maybe with the slides afterward?
Definitely, yes.
Okay, thank you. And I will say what Kayla is talking about with the follow-up email, it was very organized, had a lot of resources. There were some questions about, like she said, where are you with the stages of recovery? Are you in recovery? And so it was just the response time was very quick. And so I just thought it was a really interesting process and a really interesting way to see how they're supplying information. So our last stage of change that we're going to talk about today is the action. And so again, with our question here, do you have a substance use disorder and you're ready to take the vaccine? And here's our kind of our statement and our encouragement. They're free and available to anyone that wants one. And we add protect yourself. And our posters show, you know, a mom with a baby saying, I want to, but maybe I don't have insurance. And just like we said, reassuring them that this is free and available and there are resources and contacts to be able to get to that vaccine center. So our link here shows the vaccines.gov that we've used a lot. We've used this on our little postcards that we handed out. And then we've added a way on this one to connect with a patient navigator. So Impact has patient navigators. They work similar to what it sounds like a vaccine navigator may do on Kayla's end, but ours a little bit more program-wide at this time. And so we have 3 demonstration sites under Impact. Wheeling Hospital Perinatal Transition Program. So we have Catherine Livingston that works as a patient navigator there. Abby Baker, who is our CASA site, and she works with our moms and families through CASA. And then Ashley Blair McKenzie, and she was with Burlington United Methodist Family Services, and I see her name on the call today, so thank you, Ashley, for joining us. And I have their emails there, so they're always a point of contact. Even if a mom or a family is not eligible for our program, we still like to be able to share as many resources as we can. Our website also has a referral button, so if you think that someone is needing help or assistance and has an infant 0 to 3 months of age that might have been exposed to substances, we're happy to have them. If they're in one of our 9 counties that you can see highlighted here, we're happy to have them join our program. So we mentioned a little bit earlier about our Impact COVID website section. So here we just provided communications and messaging resources to help, like we said, build this confidence in getting the vaccine. So we have social media, sample messages, a communication toolkit that's free to download, and tons of other resources. And that's the link. I'm going to try to screen share with you in a few minutes to show you that site, but there's the link if you need that. And here's our communication toolkit. Has some of the same things listed there and are linked directly to the toolkit. So another thing that we have added is a button on this site for people to share their vaccine success stories. I like how it was added in the chat that hearing about other people having success, that's kind of a good way to encourage others. So we added in our campaign that we're doing that we would love to hear vaccine success stories. So we have #ImpactCovid. We have an email address there that you can encourage others to email their success stories to. And then the button that I mentioned says, did you get vaccinated? Tell us why. So I'm going to stop screen sharing for a moment because I want to be able to show our site here. And Nina probably would have been way quicker than I am today. Okay, so here is what our website for it's under our entire Impact website, but Impact COVID. We have our button here in the gold. Did you get vaccinated? Tell us why. And when you click on that button, just to fill out a little bit of information so we can see what your success story was. And again, name's not required, so you don't have to tell us who you are. Your clients don't have to tell us who they are. And then we have this information broken down. Am I at risk? And then we have some links here. Again, we mentioned the study, encourage them to learn more. And then we have drug use during COVID-19 and the easy to read materials. Again, these are similar things that are on our Facebook messaging and our poster, but we did put it into website form. Is the vaccine safe? What are the benefits? And where can I get it? And we even added in some of the barriers that we talked about in transportation. We have some transportation resources here. We have some contacts to the West Virginia COVID sites where people can get West Virginia information. And then down below here in the blue, we have the hashtag Impact COVID communications and social media toolkit. So I want to click on here to highlight this for just a moment. And so here we talk about our social media sample messages. And these are things that you can download and use our graphics that have been developed. So it's kind of like we said, goes on the stages of change. We have phone numbers here that you can call, other links that we're happy for you to share. And I'm just going to kind of scroll down so you can see those. We also have our posters here. So you can download the printable posters, you can download social media graphics because they have to be in different forms so that they're not blurry and on those type of things. So again, these are all based on our stages of change. We also did another poster that you can see here, and it talks more about the increased risk of severe illness and death. So we kind of have a little bit more targeted messaging here. And then this one with the different question marks has all 4 of those stages of change kind of on one poster. As you get to the bottom, these are where we used images and things for our billboard. So that kind of gives you that piece if you would like to share it. At the bottom, we decided to add some more information for providers. So links to some toolkits, audience-specific toolkits, vaccine confident toolkits, and so on. So feel free to check those out. Those might be helpful to you and your coworkers. Okay, and then I just wanted to kind of show a slide here that talks about kind of a one slide that sums up what our whole campaign was about. So working to increase vaccine confidence, working to vaccinate all eligible people by the anniversary of the ADA on July 26th, how to join the campaign, where our billboards were located, and for requesting additional information. Thank you. It looks like Melina's put a lot of the links in the chat, so that is helpful. Thank you, Melina. And now I just kind of wanted to open it up. Are there questions that you all have? We did put together some mailings. We looked at including our demo sites and a peer recovery coach site that we have. We looked at 96 substance use facilities and agencies in West Virginia. And some of you may have received a big tube in the mail and thought, oh my goodness, what is this? But if you haven't opened it up yet, I encourage you to do so. We put lots of posters and lots of flyers, and we put some of our postcards that you can hand out and just share with your coworkers, your families, your participants, and just encourage them and help us get the word out. So that was a big mailing that Melina and I had an entire truckload that we shared. So we were happy to do that. Does anybody have comments, questions? Maybe you have a success story you want to share. Maybe you need a resource that we might be able to help connect you to. Okay, Brenda would like some information. We'll see if we can get that out to you. if you could, Brenda, if you want to share, I'll put my email in the chat. If you want to send me an address where I could send that.
Are there other suggestions or ideas or pieces of information that maybe we hadn't thought about that would be helpful to you that we could research or try to find to include on the website? You know, I'm going to link to some of the webinars that Kayla shared on the website soon.
Yeah, and maybe even if you have time to look over the website or look at the information, maybe you know, later on you'll have questions. So feel free to follow up with us. Like I said, I put my email in the chat. Yeah, it's always. Oh, go ahead, Kayla. Go ahead.
I just want to share like one other thing, because we've realized that, you know, the availability is there's more availability of the vaccines, but like you've addressed, and I think some people have addressed with like the barriers. One thing that we're doing with our project is we're working on bringing mobile vans to areas that are having difficulty getting access to vaccines. And so this is something we're going to pilot in hopefully Massachusetts. And then we hope this is something that we can go like throughout the United States. So I know that like that is sometimes a barrier to people because they can't. It's great that you guys have that transportation link. And so it's really cool to see the different things, like the work that you're doing is just, you know, with the posters and the billboards and the education. It's like there's so many innovative ideas out there that are really, really great. And so it's so awesome to see all the different things that we're doing to try to just help people be healthier and protect themselves. So I'm really excited about the work you guys are doing. And if I can help with anything or anyone has any questions too, just let me know. And just personally, I am in recovery from a substance use disorder, and I just had a son in January, and I was very hesitant personally about getting the vaccine because of the idea that it was so short. And I personally got vaccinated because I wanted to protect my son and myself. And, you know, I'm very happy with my decision. And so like, I know it's not someone that wrote into the Vaccine Navigator thing, but, you know, my personal experience makes me even more passionate about making sure people get educated, because I had, you know, my son's pediatrician, you know, call my fears. I had my personal doctor call my fears. And then being on part of this initiative, getting so much information, it really has educated me about, you know, making what was the best decision for myself and for my son. So I thank you for the work that you're doing.
Thank you, and thank you for sharing your story. And I think that's exactly what we've been talking about. We're not trying to judge, we're not trying to push it. We just want to be able to make the information available in case someone does have questions, and to think about, like you said, their infants and their babies and future health long term. Yeah.
I'd like to also add in this. I'm Brenda Cook. I'm a CLM. That's a certified lay minister at Central United Methodist Church in Fairmont. I also am a recovering addict, and I'm doing a ministry for them, motivating recovery, working with families of addicts to educate. And I didn't know about Impact West Virginia until Brad got the notice and passed it on to me. I got lucky, he was on vacation, so I had to come. This is phenomenal information. The more you get out to people, the different ways you can get out to people makes such a difference in the world. Kayla, when you were talking about taking it to the people, the vans, I was in Florida for 32 years and saw a lot, I worked with HIV and AIDS education there. And you take it to where the people are. We used to take vans around with tests and sit in parking lots that we knew were drug areas and wait for people to come by and get tested. You know, the same type of thing. The more you get the information, I'm just impressed and blessed both today to see what you're doing and the impact you can make. It's been hard for me in some ways to find people who are working along the same lines I am. I'm excited. I got all your information. She's gonna send me the slides. Y'all in trouble now. You're gonna wish Brenda Cook had never showed up at your meeting.
No.
But it's phenomenal what you're doing. It's just, I'm excited. I'm excited that you're looking at every part of addiction. Addicts are so busy getting high that they don't stop and look at things. But if you put it right there in their face, they'll see it. And it makes a difference. It makes such a big difference. So kudos to you all. And thanks a lot for allowing me to be a part of it. I appreciate you.
Thank you, and we're happy to have you join. And I think I can maybe also get you connected with Ashley on here. I'll send you some information since she covers Marion County for us. Be a good connection. Okay, anybody else have questions or comments? Things that we might be able to do for you or support you?
I did just want to share that we have seen mobile vaccine clinics sponsored by health departments in the last few months, starting to come up here in West Virginia. I know there was one in Mannington by the Marion County Health Department. There was one by the Grafton Taylor Health Department. So if that is something that you guys are interested in, I encourage you to contact your local health departments and see how you could get a vaccine clinic set up and what that process is, because I know that they are starting to pop up around our state as well.
And just a note, as we were talking about impact, and it is on our website, but we do cover 9 counties. So we're in Mon, Harrison, Marion, Preston, Taylor, Tyler, Ohio, Marshall, Wetzel. And we are a research program. We take moms with infants 0 to 3 months of age that have been exposed to substances in utero. And then we encourage them as part of our program to be a participant in a home visiting program. And that's has a wide range, whether it's right from the start, whether it's a CASA program, a family court treatment program. So our home visiting kind of is a wide range there. And we're basically just looking at them to see what type of information we can gather based on screens like, addressing childhood experiences or substance use screens and things like that, and looking at, longer term consequences of that use as they get into school age and early childhood. So just kind of looking at, all those pieces. We have a family portion of our website and a provider portion on our website. So lots of training modules if anybody needs social work or nursing CEUs, those are free on our site. The families, they don't have to take the quizzes on their side like you do if you're a provider, but we just have tons of modules about child development. Like I said, ACEs, we have some new ones, children with special healthcare needs coming, a mental health module coming. So just really excited to be expanding that piece. This grant was kind of icing on the cake for us to get to work with the COVID piece of it. And so we're just really excited.
So I just wanted to add that we also have an email list where we regularly share resources, training opportunities, new blog posts, new initiatives and things like that. So if anyone is interested in being added, you can just put that in the chat and we can make sure that we get you added so you get the news and updates.
Thanks, Selena. Yes, and I'll send the PowerPoint slides. I'll send Kayla's training that they have coming up. I'll send the link to that. We will even try to get it on our training calendar, Melina, on the site if we have time. Okay. Feel free to reach back out to us. Thank you all very much for joining us today. I hope that it was some valuable information to you. Have a great afternoon, and we look forward to meeting up again. Thank you so much, Kayla.
Thank you.